pleasure to be here at the Gurdwara because we are close friends to the Sikh Community Association, and Amajit and Pindi and the others here have been enormously participative and collaborative in working with Hope and many other local charities in terms of alleviating poverty over several years. So we're really pleased to be hosted by them today. So, a welcome to everybody. This is the launch of the Poverty in Northampton report, which was commissioned by Northampton Hope Centre a year ago now. And it represents, this report launched today represents the culmination of an intense period of research work, interviews, writing, analysis that leads to the final report that you hopefully have had a chance to see today. And as Chief Executive of Hope, I'm enormously proud of all the support that we've received from so many other people in helping to get this report off the ground. It truly is a collaborative product. It is not just a Hope thing, it is the product of lots of other people. And you'll hear several of those voices here today. The actual work that was carried out by people on behalf of Hope. So Louise, if you could move the slides on a moment. And again. Why did we commission this? We wanted to reflect the fact that COVID had an enormous impact on poverty within the town. It had enormously increased the amount of work that everybody had to do in order to meet the needs of those in poverty. New organisations emerged, which have done amazing things. New energy came into the whole world of poverty relief. And we knew that there were lots and lots more people who were hungry and poor than ever before. And that's why we all, and many others in the room, got going in terms of doing what we were doing. But we wanted not just to give anecdote, we wanted to give a bit of evidence in the form of qualitative lived experience from people who had experienced and were experiencing low incomes and poverty. And we were particularly concerned to reach out to different communities to map needs in specific communities, and Andrew will talk about that. But I want to just give a quick word about who's done this work for us. And much of this work has been carried out by two people. One who's not here today because she's now doing international development work in Jordan, and that's Emma Matthews, who did all the writing of the report and a lot of the background stuff. And hopefully at some point she will see the report online. But a lot of the practical delivery was done by the gentleman sitting to my right. And it's a weird thing. We found out that 45 years ago we were both undergraduates on the same degree course. Andrew was 2 years above me. And we have no recollection of ever having met each other, even though I knew loads of people in his year. So it's a weird thing, but 40 plus years later, he's come to Northampton and has been a brilliant supporter of Hope and a really committed person to the needs of those who are most marginalised and in poverty. So Andrew did a lot of the work, and he will talk through a lot of these things. So can I have the next slide, please? I've said most of this stuff. The important thing to stress here is that we didn't want to just hear the views of community leaders, but they've been really important to the delivery as well. And two are going to speak in a minute as part of the launch. Anne Wankeri from the United African Association and Elena representing Eastern European communities and Russian communities who are living in Britain and in Northampton have been enormously helpful in reaching out to two particular groups that we were concerned about, which is wider African communities and EU communities. So they've been enormously helpful, and you'll hear from them in a minute. But I'm not going to talk any longer. I'm going to hand over to Andrew, and he's going to talk about how we conducted the report.
Thank you, Robin. So I'm Andrew Brown, retired Church of England bishop and a volunteer with the Hope Centre. I don't normally wear all this stuff in a week, but I am this morning. It's really good to be here with you, and a huge privilege to have worked on this project with the people that Robin's been talking about, and to have met so many of you in the process. As Robin said, the Hope Centre for a long time has been very aware of significant levels of poverty in the town of Northampton, but of course, like in many other parts of the UK, the COVID pandemic made it significantly worse for many people. And during the pandemic, in fact, we were, along with others, helping people to access hardship funding from the Red Cross and from the government too. And as a result of that process of helping people to access funding, and we met all sorts of people, built partnerships, and began to hear all sorts of stories that we thought were really important that we tried to capture somehow. And the idea being that if we could do that, capture stories, do some research, we could actually offer what we're hearing and learning to policymakers and to partners to see what we can do together, to work together, to help people who are facing poverty to alleviate their own situations. So the Hope Centre recruited Emma Matthews, as Robin has mentioned, and we work closely with the United African Association particularly, and Emma Kiri is here with us this morning. And we were going to decide that we would use a process called Participatory Rapid Appraisal, a bit of a mouthful, PRA, developed by Robert Chambers at the University of Sussex in the 1980s as a way of going into places where there is real need in the African continent, the Asian continent, and to, instead of actually sending in ethnographers over 1 year, 2 years, and getting some really good data at great expense, the idea was to get a rapid assessment of what the needs are on the ground, and for it to be completely outcome-focused, action-focused, rather than just a report. So PRA has sort of 3 or 4 strands to it, really. The first is that you run facilitated workshops with groups of people, and we met with the people you might see on the next slide. Is that the next slide? Yes, so African communities and African Muslim women, and 2 Eastern European communities and households facing poverty, and homeless service users. The workshops were held over the course of 1 whole evening with all sorts of activities and questions and conversations facilitated and structured very carefully. We wanted also to meet with the Bangladeshi community here in the town, because we know that they are about 1.7% of the population in the town. That's about 3,600 people. It wasn't possible this time for all sorts of reasons, but we are looking forward to working with that community going forward as we see what comes out of this process we've been involved with. After the workshops, then what you do is you triangulate what you're hearing by having interviews with what they call key informants, key community figures, and then you meet people from various households too, to go down to sort of a more granular level. And then you check all that against the data, the available data that you have that's circulating out there in the council and other organisations, big organisations nationally, who are providing poverty data. So I think it's an outstanding report, even though I say so myself. I didn't write it, Emma wrote it, that's why I can say that. But it's a real eye-opener. And I think that's what we say in terms of process, actually, Robin.
Yeah.
So Anne was going to say something.
Yes.
Thank you, everyone. I'm Anne from the United African Association. The charity's been running since 2014, but it was during the pandemic that we realised the scale of the problem. A lot of the people within the African community work in the healthcare sector as care workers. Now the care homes shut down or reduced the number of staff, and a lot of these African staff were working as carers, basically on 0-hour contracts, and really their work dried up. And because most of them have no recourse to public funds, they are allowed to work, but they've got no recourse to public funds, there was no income for them, or it had reduced significantly. We'd gone from people working 6-7 days a week to 2-3 days a week. So there was poverty faced there. Of course, they're not entitled to social housing, and they've got high rents to pay, so they were struggling with that. So then that is how the inception of the food bank came about. And we were grateful to Northamptonshire Community Foundation, who actually supplied the first grant for the food bank that enabled us to give food to people who really did not have anything. We came across people who hadn't eaten for 4 days, who were basically staring at their walls because they couldn't get to a food bank. They did not know of a food bank. They did not know if they're eligible or not. And I remember taking this bag of food to this gentleman, and I had to help him carry it in because he was that weak. Basically, he didn't know what to do. So there is food poverty, and it's still going on there. Fortunately, the situation has eased, but there are still people struggling out there. People who can't work, in particular people who've got long-term conditions, who are quite ill, who are struggling with food poverty. It still goes on. funding has been cut, but the struggle is still there, and it is, people are silently suffering with food poverty and other means of poverty. We're so grateful for the hardship fund because it meant people who were not entitled to public benefits could get there. And it was good that when we then built the relationship with the Hope Centre, because for a number of years we've been trying to work with the Hope Centre. So this hardship fund, the Red Cross hardship fund, enabled us to do that. So really, really grateful for that. And we're really grateful to be part of this study, just to give an insight as to the poverty faced by the African people and the wider Muslim community. We've had those as our food recipients as well, and they've come forward, they've been on long-term unemployment and telling us the struggles they face. But I'm sure Andrew, Robin and everybody else is going to give further insights. Thank you.
Thank you, Anne. So what I'm going to do, what Robin's asked me to do, is just take you through. These are the broad headings that you'll find in the report. And I can't, obviously not going to read the whole thing, but it'll give you a flavour of what it is that you will find when you do read it. And to help me, I've got some of our colleagues from the Hope Centre who are going to read out for us some of the quotations at certain moments, just to bring the voices that we've been hearing into the room this morning. So we're starting off by looking at supporting the community. So during COVID, of course, like everywhere else in this country, isolation was a real problem for many, many people. But it was exacerbated, I think, for people in the communities that we were actually meeting. For all sorts of reasons, but mostly culture, language, and despite the fact that in one case particularly, the Polish community has a very strong online presence and a community, a Facebook group of some 16,000 people, but actually they weren't able to meet one another face to face, and people were feeling very cut off, unable to speak the language, and really struggling with mental health issues as a result. Washington, I think, has our first quotation.
We don't stick together. Many people are lonely.
Thank you. So we don't stick together. Many people are lonely. But of course, what many people did have was access to a religious institution, be it mosque or church, to provide support, encouragement, mutual support, sometimes counselling, often information exchange. What's going on? Where do I go to find help with this or that problem? Conflict resolution, also really important, and translation work. But we also heard that going to a religious institution isn't necessarily going to solve all your problems. So we discovered through workshops with the African community that people who go to some of the African initiated churches have huge pressure put on them to tithe, that is to give 10% of their income to the church, and sometimes more actually. And people who don't have very much at all felt a tremendous pressure to do that, even though it might mean that they weren't able to feed themselves or to heat the house. The same has been found to be true of people in the Polish community. They've been telling stories of being expected to give money to access pastoral liturgies like baptism or marriage or so on and so forth, and that's caused many problems too. But for all of the people that we were talking about who do refer to a religious community, confidentiality was an issue that we picked up all the way through. Accessing external information and support, all these things are really important to themselves, and this might seem a surprising thing for you to see there. But because of course we all know that there are many, many different sources of information available out there in the town. But that of course for people who don't necessarily have the language skills or the IT skills can be confusing. Many are actually completely unaware of the help that's out there. And many people have talked about having issues with referral systems. So when they do actually find somebody, perhaps from local council, who might be able to help them, they often felt as if they're being shunted from pillar to post, that no one's really listening to them and taking them seriously. And of course, during COVID, all face-to-face meetings were suspended. So once again, that sense of isolation and not knowing where to turn and how to source help was a real issue. There are other barriers, though, to accessing information as well. I mentioned lack of literacy and IT skills, which meant, of course, that people have been relying very much on word of mouth within their community. And that, of course, has meant that sometimes there's been misinformation passing around, which has not been helpful at all. And of course, there's always been gossip. Wherever human beings are, there's gossip, and that's been an issue, I think, for many in these communities as well. Ruben, I think you have a quote, please.
People won't come to access the help. Some of them don't ask questions and think that this is how the system is.
Thank you.
There is a lot of fear and stigma, and people don't talk.
Thank you. Can you hear the right hand? Yeah, good, thank you. In the Somali community, which again is quite significant, you'll find all the metrics and stats about that in the report. There's a real sense in the community, people are very proud, they don't want to share their issues, their problems, their struggles, and so they hide them. And that, of course, leads to a lot of stress. In the Eastern European community, again, low English skills often, and a real lack of trust in the authorities, which really is a legacy of communism. I've never actually heard this expressed quite as clearly as we have, as we're meeting these communities and hearing the things that we recorded in the report. So overall, considerable outreach, I think, is necessary. One of the things that we think would be really helpful would be one sort of common hub to which people could refer themselves to find out what's actually happening in the town in terms of support. Food poverty, as you'd expect, as Anne's already mentioned, has been absolutely massive. The Hope Food Club is well established, and there are other food banks, of course, operating in the town as well. But during the pandemic, the scale of need seemed to increase sharply. And once again, you've heard this phrase used before, it's those who have no recourse to public funds, the NRPF conditioned their right to remain in the country, who've been suffering the most and been the most vulnerable, really. United African Association, Anne tells us that before the pandemic she had about 30 households that she was relating to. During the pandemic it rose to about 100 households that you were actually working with. And almost half of those people that they're working with are actually NRPF, so they have no recourse to public funds at all, which might mean that they can work, but they can't draw on any government help should they actually be sick or whatever. Washington, I think we have a quick, please.
We are eating breakfast and missing lunch, but what is important is that the grandchild has to have food for lunch. She does not understand, but for her sake.
Thank you. You won't be surprised to hear that universal credit has been something that people have been struggling with. Increased living costs, rising food prices, and the loss of the COVID-19 grant has been very challenging for lots of people. Zahra.
I'm counting every single penny. It is okay because it's only me. So if I have only 2 potatoes tonight, it is okay for me. It is enough. Tomorrow will be a better day. After paying my bills, I'm left with £100, £200 for a month. How can I live like this with money? You're going to the shop and I buy the food for £50 and I look at it, is this going to be enough for 1 week? I buy milk only if I know people are coming to my house because I know people will like a cup of coffee with milk and I feel bad if I don't have it. I don't mind for myself, I can have a black coffee. I only have 2 pieces of bread for the day and I think that is enough. I will buy tomorrow. It is okay, it is temporary.
Thank you. Many people clearly didn't know, we found out, that they could actually get an advance on their universal credit. They'd have to pay it back, of course, but they could get an advance if they were struggling. Again, Zahra, please, sorry.
The whole month, they only pay me £120. Imagine you have kids and bills that you want to pay, and you are waiting for the whole month and then you receive £120. I called them, but they didn't help me. For £120, how are you supposed to pay the rent? You have electric to pay, you have council tax, you have water, you have a lot of stuff, and the kids need food and everything. Can you imagine? I was crying for the whole night. I didn't know what to do. Normally, if you have family members, you have a mother and a father that can help. But when your family members are very far away from you, and you don't either have a husband, you don't know what to do. I think some people here die of stress. There are a lot of people here with a lot of stress. You don't know what to do. I don't know.
Thank you. it's good to have other voices to break up my voice. Thank you for that. So there are other barriers too to seeking support. In the Eastern European community, we found that most of them come from places where there are no such things as food banks. They'd never heard of them before, and so they wouldn't know what to look for or where to look for them. And in the African community, we found that people are brought up not to complain. And Anne's already told the story of the man that she found on the floor who hadn't eaten for 4 days and hadn't wanted to ask for help. So extraordinary. Moving on to housing, there's quite a lot. You'd expect this to be quite a big section, and it is actually. The bits of the report, we try to focus on the conditions, so the poor conditions that some people are living in, the housing they've managed to get access to, and the complicated application processes that many people experience as they try to get social housing, particularly from the council. And of course this has wide-ranging implications for people in terms of mental health, of course, but also physical health and stress. Washington, I think, another quotation, please.
Whenever we go to the council, we come away feeling rejected, or they push you on from pillar to post.
Thank you. Accessing a council house has proved quite difficult for many people in the communities that we've been talking with. Just the documentation required, if you think about it, is difficult if you are fairly newly arrived in the country. Again, people with low literacy skills or IT skills and poor English really struggle as well to understand the processes of the system that they're actually trying to get into. And there are stories that we picked up of people being refused housing, or in one case, a lady from Poland was told quite plainly, well, you ought to go back to your home country. Washington, again, please.
I'm paying £900 out of £1,500 I get on my house. After paying bills, I don't have much left for clothing and food for my 2 children. I reduce costs by walking everywhere and cooking large batches of meals for the week. And now the United African Association helps me with food parcels.
Thank you. What we call irregular migrants, of course, life is really, really, really difficult. This includes most people in the African community, but also Eastern Europeans now that we have left the European Union. And many are reluctant to approach their landlords if they face an issue with poor conditions in the housing or an issue to do with rent and things, often for fear of being reported and then deported. Thankfully, street homelessness in these communities has been rare, and that's partly because people do belong to extended families, and there's a culture of hospitality in all the communities that we talked with. And so there's real heartwarming stories of that, but it does mean that people are sofa surfing, sometimes for months on end. Poor conditions, well, I mean, you can imagine these, so issues of damp and mould, but also now, of course, food poverty is going to be an issue, isn't it? And that's a function, the poor conditions really are a function of high demand on housing, and of course the poor conditions do have a high impact on people's health. And there's a perception out there that we were picking up quite a bit, which is that new migrants tend to be housed fairly quickly, whilst there are many people who are waiting 3, 4 and 5 years to get on the housing ladder. And we have a harrowing story of a lived experience of one woman living in a house with leaks and no working toilet or electricity. Zara, please.
There was no heater. I stayed with kids in one room because there was no heating. I stayed there for 4 years. The council visited here to check and did nothing, and only gave me small heaters. I was going everywhere to complaining about the house, that there is no heater in the house. And when you go to the toilet is not working. And sometimes when you turn on the light, there is fire sparks because the water was leaking. Sometimes I got shock on my hand. It was very hard for me to be honest. They know my situation, but they say, we don't have a house to give you. You have to manage through the winter. It was very cold. It sent my kids to the hospital. Even me, I had the problem. I was getting water in my lungs, pneumonia. I was in the hospital, it was very hard for me. It was very painful for me. I was having to go to the emergency many times.
Thank you. Homeowners struggle too, of course. The classics of asset rich and income poor buying the trap. There's one elderly user who comes to the Hope Food Club who has a bungalow, and she said it's rapidly deteriorating because she can no longer afford to repair it or to heat it. If you can't heat a property, of course, it gets damaged by the wind and the rain and the weather and things. Unfurnished houses, unsurprisingly, is another massive issue if you have no recourse to public funds and you're trying to feed yourself. So basic items can cost a lot of money, even if you go to the British Heart Foundation. Ruben, please.
I help a woman who doesn't have an oven, nothing, and she's a single parent, and they are sleeping on the bare floor.
Thank you. So the next one, access to healthcare. It's what we've heard is that during the pandemic, it was harder for people to access not only basic healthcare but mental health services as well. And again, it was people who have no recourse to public funds who are particularly struggling with this. Those who can work when they have no recourse to public funds, of course, depend on their health. And during the pandemic, a lot of work closed down, and if your health is poor, then you can't go to work, which means that you can't actually feed the family or keep warm. It's shocking to realise that neither they or the community leaders were aware that they have a legal right to register with a GP, even if they have no recourse to public funds. All their status is uncertain at the moment. And there's a real fear of detention, deportation, and fear that if you do go to the hospital, for example, that they might track you and they might report you. We heard of people sharing identity, IDs, just to go to the GP. And Anne has told us a story, a very powerful story, of somebody who went to the GP to find that her medical history recorded an abortion that she'd never actually had, because somebody else had actually borrowed her ID to be able to access the GP. Actually, you can access the GP. We know that now. We've been spreading that message around very clearly, but people didn't know at the time. Again, people with no recourse to public funds often won't seek treatment until it's really become an emergency. And then, of course, they're worried about hospital costs. And they feel as if the hospital costs aren't really clear or made clear to them. And that actually has led to a higher death rate, I think, probably during COVID. There are other challenges too. Language barrier, we've talked about, literacy, the impact of those things, but also translation and confidentiality. So if you're going to a doctor and you take somebody with you to translate for you, perhaps you don't want the doctor, your friend, to know what the issue is that you're taking to the doctor, because that might get spread around the community that you come from. Again, on healthcare, the cultural barriers too. Many Africans are reluctant to consult the GP because there's a stigma attached to having poor health. And we've talked about lack of discretion and gossip as well. Washington, you have a quote to think about that.
I would ask to change doctor or nurses if they were Zimbabwean. There are doctors who tell the whole community. There was one who even sneaked pictures to share.
Thank you. So as you expect, if you're feeling or you're facing stigma, that leads you to extreme secrecy and feelings of shame, and that becomes very hard to handle as well. And it becomes a downward spiral, and you stop trying to seek support. We did discover that autism there's a high incidence of autism, particularly in the African community. And many people, because again of language and things, didn't really understand why or what was going on or where to go for help. Ruben.
There are lots of children with autism, and people ignore it, and parents don't understand it. Many parents are in denial as there is a lack of education on the issues, so parents are not accessing the services that are there to support.
Thank you. So if you can't go to your GP or the hospital and things, then alternative cures are around. You might go to the church and ask your pastor to pray for you. You might actually ask family at home to send traditional medicines through the post. You can actually use those. And of course, religious belief itself has an impact on whether or not somebody actually understands or can accept the health issues that they're facing and will seek help. Washington again, please.
Culturally, it is an extremely sensitive subject because if you mention mental health, you'll be ostracized and deemed as a crazy person. So people will try and avoid you. There's such a stigma. It is a huge sort of problem that we are all facing and trying to address. So particularly in the Eastern European communities, it is quite stigmatized and it is difficult to overcome these cultural barriers.
We're coming into land, just 2 more to go. Safety is just very briefly to say that for all the participants that we actually interviewed, Northampton does not feel like a safe place to be. Zahra, you had a quote, please.
Northampton does not feel safe. It is not well lit and there are lots of drug dealers. I walk everywhere and I feel scared to go outside after dark, even to go to the shops, which is a problem in the winter. I'm particularly scared for my 15-year-old daughter who has to walk back from school for half an hour. I talk to my daughter on the phone the whole way to make sure she's safe.
Thank you. And there's an issue with distrust of the police. Amongst Europeans largely, and again, if you come from Poland, that's again a legacy of communism, and people who have no recourse to public funds often feel reluctant to report violence in case they are reported and deported. I'll move on, Ruben, I won't take that clip at the moment. And just the last one, deportation at work, is an issue for all the communities that we actually talked with. Modern day slavery was mentioned, but it's quite a powerful phrase, so people will think to use it. The most vulnerable, again, were the irregular migrants and asylum seekers with no right to work, and so people are actually resorting to seeking alternative employment, 0-hour contracts, and paid well below the minimum wage. Employment agencies are trying to help them, but what they're doing actually is providing fake IDs, sometimes we found, and creating CVs for people, which is a lifeline for them, but again creates all sorts of issues further down the line. Washington.
Some agencies pay fair, but many pay awfully, like £35 for the night. But if you have not been working for, then £100 a week is something.
Thank you. I think we'll draw a line on the other comments at the moment, particularly trying to land. So even those with the right to work are being exploited, and many people, particularly again in the Eastern European community, with poor language skills, are not actually accessing or understanding their rights as workers in this country, and that leads to a lot of exploitation. I've said a lot, there's a lot in the report, forgive me for going on. I hope you do understand that we're not making any political points, we're just reflecting back to you the things that we've been hearing. I think it's really important for us all to accept and receive that. Thank you.
Thank you, Andrew. You may have thought that we've actually missed out one of the headings, and that was about advocacy and representation. Because what you've heard is a picture of exclusion and marginalisation by whole swathes of the community. Some of those are people from the African community, some from Muslim communities, some from Eastern European communities, but also people who are homeless, people who are accessing food banks and so on. And this is a story of complete societal marginalisation, where people have no stake, as it were, in the democratic systems that exist, in representation through councillors, and all these kind of things. And just to capture that a little bit for one particular community, which is the Eastern European community, I'd like Elena to share some of her experiences in this regard.
I'll just Thank you, Bishop Andrew and Robin, for this, and all amazing organizers for this honor and opportunity to be part of such important cause to combat poverty in the place where we all live, we work, we study here, and ultimately we call it home, so we do want to make it better. We're all driven by the same desire to make the life of people in Northampton better, easier, more dignified, and in other words, more meaningful. So it's not just a constant battle for survival, but actually life in its fullness. We all have the same goal, although we approach it from different angles and from different methods. I have been living in the UK for the 17 years almost, 15 of which I have been working with and representing Eastern European community, which I'm part of. I started off as an interpreter in NHS in Northamptonshire, and currently I run a resource centre at St Anne's Orthodox Parish in Northampton Hope Centre, providing support to vulnerable women mainly escaping domestic abuse and refugees. Since we established St Anne's Parish Support Group in 2010, I have been a contact point between the local authorities and our community of Eastern European descent, people from Latvia, Lithuania, Estonia, Moldova, Romania, Ukraine, Russia, and all my communication with the council, police, social services, health providers and so on started and ended at the reception desk. Until I met Bishop Andrew about 3 months ago, I had never ever been approached by any representative of the local authorities to inquire about our community, our needs, our struggles, our challenges. There is no doubt a number of reasons for that, objective and subjective, but the point is, at the moment, there is no established formal relationship between the council and local authorities and Eastern European community and other ethnic minority communities, with probably exception of Polish community because they're more established and represented here in the UK for the historical reason, which has been here for years. Obviously, this current situation puts a lot of our communities in a huge disadvantage, and it causes people to live in a deeper level of deprivation than they should be or need be. The council on the other hand, the council is missing out on a valuable opportunity to gain support and votes of unrepresented electorate, which constitute a large sector of population in Northampton. The solution is obvious: advocacy and representation. The council members, community engagement officers and other local authorities representatives need to establish communication channels with community leaders and the members of all ethnic minorities communities who experience the challenges and problems that their particular community faces. It could be various platforms, just like this one, for example, or it could be an actual legwork. So people go to the communities, meet with people and talk and hear the stories by themselves. If each member of every diverse community in Northampton felt that they have been seen, heard, or at least acknowledged, it would have a potential to transform the lives of hundreds, if not thousands of people currently living in poverty. The council will have an accurate picture of life of people living in Northampton, so they can help to establish trust and rapport with the communities. In return, local communities will have access to services and help that seems inaccessible at the moment. It is a win-win situation for all because we'll combat poverty in our society in its entirety. Therefore, I would like personally to invite you all to visit our communities, not just St Anne's, but I think it's okay if I talk on behalf of all other ethnic minorities communities, that you will be welcomed with open hearts and open arms. Thank you for your time.
Right, we're coming to an end now. Thank you so much, Elaine, for that. That was absolutely fantastic. And what we've created here, if you could turn on to the last slide, please, is a picture of two societies. There is the mainstream society, and that itself contains a lot of people who are poor, the kind of people who use food banks, food clubs, and larders, and everyone else that is out there, the kind of services that Miranda and Teresa and Emma and others run, and we run, and so on. So there's a lot of provision for people who are, if you like, from the kind of white English community. I'm going to call it that, as poor labour. But there is a whole load of other people, and it includes the homeless and proselytes, many of whom are themselves Eastern European, for example, who are completely isolated and excluded from representation or participation in the society that we live in. And given the sheer numbers of Eastern Europeans, for example, that there are in our town, this is a scandal that there is not this kind of flow of communication back and forth. And it is true of the African community as well, and Asian communities of different times. So in some ways, although this is a report about poverty, this is much more than that. This is a report about exclusion and marginalisation. And I think that's the overwhelming thing that's come over for me. And this is absolutely central to Hope's purpose and aims. Because we aim to reach out and hopefully to speak for those who have no voice. And we have allied ourselves with others who can help us reach wider and yet more diverse communities to give that voice through this report. So in terms of where we go with this, there are many, many recommendations within the report. And some of them are very, very practical. And some will be aware that West Northamptonshire Council is about to produce a high-level poverty strategy, which they will then turn into an action plan below that to deliver real change, we hope, to the poorest of the poor that we've been talking about. I've been fully involved in all the working groups and all the thinking and all of the drafting on that, and some others in the room have had a hand in that as well, Rachel, Emma and others. So there are people here, Daniel, and there have been lots of people who've had a hand in that. And we hope that this set of recommendations will lead to practical changes and actions that strategy will encompass. But I want to stress that nobody, I hope, should feel this is all down to the council. Just let them get on with it. It's not. This is down to everybody. It's down to Hope, it's down to everybody in the community, the church, faith groups, other religious organisations, other community organisations, however we can, to find an active, proper response to poverty and to bring those communities into one society and not